you are talking about the areola, you can make that smaller. I feel like a common thing we've been recently asked is the nipple and the areola. Sometimes I feel like I would think that's one and the same if I didn't know better. Because I know we did a nipple reduction not too long ago, and I was like, oh,
Wait, what's this? Yeah.
yeah.
So, right. So that's two different entities. Plastic surgeons tend to talk about the nipple, which is in the center, and then the areola, which is that outer pigmented tissue. Those are two separate entities, but we tend to refer that as the NAC, the nipple areolar complex. But we do reduce the size of the areola at the time of surgery. So no matter whether you're getting a breast lift or breast reduction, a lot of times if you have large stretched out breast tissue, that areola is also stretched out, and we reduce that to, some average sizes that are either 38 to 42 to 45 millimeters. For some reason, that, what that OR tool is called, right?
The cookie cutter. That's what we
Yes,
call it. We're
I
very
know.
informal, though.
Yeah. Everything in medicine ends up going back to food. So, yeah, we use a cookie cutter to mark out that distance and then can make the areola smaller. I think 95% of our patients are excited about that prospect. I feel like we've had a few patients who don't want their areola to be too small. And so when people bring that up, I like to know, what your definition of too small is, right? So they're usually talking 48, 50 millimeters maybe, but it's an uncommon request.
Yeah.
And you can reduce the size of the nipple as well. I'm trying to remember, that more recent patient was an implant removal. And certainly I can reduce the nipple width and the nipple projection. Those are two different things that can be addressed. It's a possibility for sure.
And then do you just take the nipple off completely? Do you leave it on?
That's another good question. So
I'm full of
with
good questions.
with a nipple areolar complex reduction, which is part of a breast reduction, we're not taking it off. But I do find sometimes I have to explain this to the patients because even though you and I know what we're doing, if you don't know anything about the surgery, your imagination goes crazy and you think, oh, we're just taking the nipple off and then we're putting it, I don't know, on ice or something. And then at the end of the case, putting it back on where we want it. But that's not what's happening. So it stays attached to the breast tissue and then everything else is kind of rearranged around it. In rare cases, you would take that off as what we call a free nipple graft. So you take the areola and the nipple off and put it back on. And those are in very, very, very large reductions.
We did one of those a couple weeks ago.